Hello, everyone. This is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. It's July 15th, 2020. Welcome to our weekly Wednesday live broadcast where I discuss concepts relevant to what we do here at Chicago Arthritis and Regenerative Medicine, where we specialize in evaluation and treatment of arthritis, tendinitis, back pain, and injuries, utilizing the most cutting-edge, up-to-date treatments available to treat these conditions with the goal of getting you better in terms of pain and function, allowing you to do the things that you enjoy and that are important in your life as well. So in our live Wednesday discussion or broadcast, I'd like to talk about things that are relevant to not only generally what's going on in practice, but also things that I think are really very relevant to me professionally as a physician as well. So a couple of things that I wanted to talk about today. You know, COVID, right? That is obviously the news of the last few months and continues to be the news of the day. So, you know, as everyone is hearing, reading, listening, there are rising cases throughout the country, which is fairly nerve-wracking stuff for folks who live in those areas. And I think has to be taken obviously very seriously. Here in Illinois, we've had a relative stability in the number of new cases, and that's despite expanded testing. So we continue to have about 1,000 new cases per day here in Illinois. And I think that's a testament to the relatively aggressive approach that the state took and the city took here in Chicago to really quarantining everybody, really kind of social isolation or social distancing, and the conservative approach that we've taken toward getting back into normal life, meaning businesses and society has been slowly inching forward. We haven't jumped at it like some other places have, which I think has really helped. But I think it's so important to understand that even though our numbers look stable, this is the moment where we need to be really, really careful. That moment where we don't start to feel overly confident, or we start to neglect the things that have actually gotten us to this point thus far. Namely, common sense, sensible approach to what's going on here, and having an appropriate risk assessment and really a dynamic risk assessment to making sure that we continue to be safe. So on the news this past week, it was mentioned that there's a new coronavirus, COVID-19 virus vaccination that has begun testing. And the initial results look positive in the sense that people develop an antibody response to the vaccination, which is good, short-term results, and there didn't seem to be significant side effects. Very, very early, right? Meaning these are very early results. We really need much larger testing and longer duration of testing to make sure that there aren't significant side effects. And we need to make sure that people actually have a durable response to this virus as well. That doesn't even get into the aspect of, are there different strains of the virus? Is it changing? But before this can be really rolled out to 8 billion people in the world, we obviously need more information, data, evidence, efficacy, side effect evidence before we jump into that. But it's a moment of positivity, as here in the United States, we have rising cases through large parts of the country, in particular, some of the more populated parts of the country. So bit of positivity there, but I think on an individual level, you still have to make really smart risk assessment and dynamic risk assessment decision-making. Here at work, I can tell you that every week, while I talk to my staff about what is our current approach to COVID-19, and as that's changing, one thing that we've started to talk about is as life slowly starts to get back to normal, what are the things that we all need to be doing to be safe in our personal lives, to help protect not only ourselves, our family, our community, everyone else here at work, and certainly patients that come to see us at work as well. And I am very respectful to the fact that a person's personal life and things that they're doing in their personal life is a separate thing than what's going on here at work. But it's very clear that what's happening in people's personal lives does affect what's happening here as well. So It goes without saying that people should still continue to be very cautious about being in large group settings, maintaining masks when you're out in public, social distancing as much as possible with people outside of your house as well. That applies to whether you're going back to work. That applies to whether you're going to your kids' sporting events, music events, activities, things like that. And I think it even applies to your own kind of social activities and events as well. And that includes whether you're having friends coming over for dinner, you're going to somebody else's house for dinner in a small group setting. And I think it even applies to how do people get back into things like getting back to their gym and stuff like that. Like you have to have a really sensible risk assessment to this. And I can tell you from my own personal life that we've had to think about this in different ways as it even affects our own family. I treat some of my own family members with some of our regenerative treatments for their musculoskeletal conditions. And, I had my mother-in-law upcoming into the office to treat her knee and her ankle. And after discussion with them and sort of thinking about it, they've made a sensible choice to not come. They'd be coming in from upstate New York. There are certain meetings that I was interested in going to toward the end of the summer and in the fall that obviously I'm going to be holding off on unless something dramatically changes. And even on the personal level, things like, we'll visit family in upstate New York and California in the summertime, usually with my daughter and my wife. And that's stuff that obviously we're holding off on. So I think everyone's making those same kind of risk assessment decisions, but understand that this is an ongoing process. And so continue to do that. And I think if you do that, you can make smart decisions for yourself, your family, community, and work as well. All right. Some clinical things that work that I think are interesting. We see a real diverse range of patients. Even when somebody comes in and says, hey, I've got a knee or shoulder problem, there's a lot of diversity in terms of how that presents. And so expectations behind treatment and what we can achieve with some of our regenerative treatments, utilizing your own platelets, blood, bone marrow-derived stem cells, is a really key part of trying to make sure that from a professional level, I'm communicating appropriately with patients, setting the expectations correctly, and getting patients the kind of results that are reasonable, expected, and aligned with what their own sort of goals are. So 2 cases that kind of describe that. The first is a young man who is 16 years old. He plays various high impact sports in high school. He's had a dislocation of his shoulder in the past, and he has some chronic shoulder discomfort with various activities. His structural pathology on ultrasound and on MRI is very limited. There's really not a lot that you see on his imaging. However, on ultrasound imaging, you can tell that he has a little bit of instability as you stress some of the ligaments with range of motion and passive range of motion. And it's a sign that he has basically multi-directional instability, which means that he has some ligaments that have been loosened over time. And that's what's causing his discomfort. That's also what's causing his difficulty with overhead activity and other types of sporting activities due to that bit of instability. And so in his case, because he didn't have a lot of other structural problems, he has a little bit of looseness in the shoulder. We had talked about what can be done. And the traditional approach would be, well, do some strengthening exercises, which he's done, activity modification, which he's done, and basically learn to live with it because you don't have anything that's too bad. And that would be a real shame in someone this young, because the typical course in someone like this would be that over the next 10 to 20 years, with slow and progressive instability, that eventually he would end up developing more significant rotator cuff issues, AC joint kind of problems, and now he'd have something that's progressed. And here's a moment where you can take somebody who's young and actually prevent this from progressing and maybe actually improve function and possibly even prevent this from getting dramatically worse over the next 10 to 20 years. And so in his case, what I recommended was platelet-rich plasma, where we're really focused on a lot of the ligaments around the shoulder to help tighten those up, to actually give him not only better function at this time and pain relief and an ability to do more over the head activity and exercises and high impact exercises, but to also hopefully prevent this from progressing. Because if you can catch something at an early stage, you have a better chance of preventing that from getting worse. That's just kind of a common sense concept, and certainly a common sense concept when it comes to medicine. For example, if you have high blood pressure or diabetes, perhaps 50 years ago, the approach was, some pithy kind of recommendations of maybe just eat a little bit healthier and de-stress your life, but nothing really significant, and then wait till somebody's had their first cardiovascular event, their first stroke, their first heart attack. Nobody would do that now. Now you would say, let's start to treat that more aggressively with diet, exercise, maybe medication, and let's get that under control so that you don't have those kind of complications. In the world of musculoskeletal medicine, that never happens, right? Or very rarely happens. Usually people wait till things get progressively worse, which doesn't make sense at all. Let's catch this at an early stage if possible. Let's intervene properly, either with the right kind of exercises, strengthening, activity modification. And if that's not enough, then jump into some of the regenerative medicine treatments appropriately with the goal of not only improving what's wrong right now, but with a pretty aggressive goal of hopefully preventing this from progressing. That's a very high level goal. And I think when you catch something at an early stage in someone who's relatively healthy and certainly someone who's young, you can still get that kind of effect. And that's a great example of young, early problem. Let's prevent this from getting worse, and let's actually reverse some of what's going on right now. So case 2 would be someone who has a more advanced arthritic process. And I'll give kind of 2 examples of that. Number 1, something that we see often is someone who's got progressive advanced arthritis in the knee for 10 plus years. They've maybe had an arthroscopic surgery in the past. Maybe they've had multiple types of injections in the past. They're probably 50 plus. Maybe they've had some injuries in the past, and they've got a lot of damage in the knee. And what's interesting is that kind of person, if you use the right kind of treatment, more advanced arthritis in the knee would typically do better with bone marrow-derived stem cells than with just PRP. But that kind of person can get a really good response in terms of pain and function. And part of that is because knees are just built to handle a lot more stress. And backs are similar. Knees and backs tend to be able to handle a lot more stress. And it's partly the reason why so many people have those kind of issues, because they handle a lot of load. And what you find is that even when somebody has an advanced degree of problems in those areas, they still respond really well to some of these regenerative medicine treatments, because those areas can really just tolerate a lot, and biologically they seem to respond pretty well to treatment. So if you take someone who has an advanced knee arthritis, they still have good range of motion, they're still relatively physically active, they don't have a lot of other medical issues, they still respond very well in a very consistent manner to treatment. The key there is you need to tell them that the expectations are pain relief and functional improvement. We're not necessarily talking about imaging improvement, and we're not necessarily talking about how do we prevent progression 10 to 20 years down the line. We're talking more about what can we do for the next few years right here. And hopefully, because they have pain relief and hopefully because they have functional improvement, hopefully they're able to do more physical activity, get to that ideal body weight. So all those kind of things help them further out down the line. Another example would be, let's say, a hip arthritis, really challenging one. When someone has advanced hip arthritis, I'll normally recommend you should really strongly consider hip replacement. What's interesting is some of those patients will still have issues afterwards, whether it's because they have a little bit of tendon-related pathology around the hip, or if they have a little bit of SI joint dysfunction or related pain that's coming from the back of the hip, or if they have something in the lower back that's still driving hip pain. All stuff that's not really going to get better with just treating the hip joint or with hip replacement, but those things can actually still benefit from treatment. In which case, your expectations are, listen, our expectations, if we're actually treating the hip joint, are more about pain relief, may not get you where you need to get, but understand by treating some of those other areas, we can still get you a decent amount of pain relief. And even if you do need to go for surgery, we may still be able to help out with some of those other issues, because we're treating some of those other secondary causes of pain as well. And so expectations from treatment are really different depending on the person, and important to make sure you discuss that with your physician if that's an issue, because you want to make sure you're aligned in terms of what the goals are, what the results that can be achieved are, and how you can actually help. Great. So those were really kind of the things I want to talk about today. You know, how we're approaching COVID, kind of the ways you want to think about risk assessment, some of the diversity of patients that we continue to see in practice and how we can help them, based on setting expectations correctly. I enjoy this. If you have questions, if you want to learn more about other topics, please let me know. And until next week, please stay well and have a good day. Bye-bye.